Anorexia nervosa is defined as an eating disorder in which the patient has a fear of gaining weight and he has a strong desire to be thin. Now, due to this fear and due to this strong desire that he has to lose weight and he has to remain weight, he basically restrict himself or herself from eating. So the normal eating habits that are observed in a particular individual are disturbed in this particular kind of pathology that is seen in this psychiatric condition that we are discussing over here, known as anorexia nervosa, and it can also be known as just anorexia in a layman terminology. So in this section, we are focusing on the anorexic symptoms primarily. What are the symptoms that we are looking for? So we are done with the SCOFF scoring questionnaire. There are these particular questions in which you repeatedly ask the individual about the self-imaging that he has, about the body imaging that he has, how does he think about himself, what is the self-esteem of that particular individual, and how does he take that food thought that he has, are there any pessimistic thoughts that he has, or he usually suffers from these pessimistic thoughts or not. So all of this is going to be the foundation when we are diagnosing these particular cases of anorexia nervosa. Now, during this diagnostic procedure, one has to keep in mind that there is a thin line between the normal eating habits and the abnormal eating habits that are usually suffered from in this condition known as anorexia. So we'll be discussing the prodromal features. Sometimes you're on the borderline and you can counsel the patient and put him again in the normal criteria. So there is again, there are a lot of central features that he or she may be suffering from, and that is again going to emphasize on the fact that basically there is a full-blown anorexia nervosa in this particular individual that we're talking about over here. Then there are a lot of psychiatric comorbidities that can exist. For example, people suffering from schizophrenia or schizoaffective disorder, or a lot of mood disorders. There can be these depressive episodes that a person can be suffering from. And again, all of these are going to highlight or lay a foundation towards these anorexic symptoms. So over here in this section, we'll be discussing the clinical features, mainly the symptoms, as the patient would describe them in his or her own words. They're going to basically be very effective when we are diagnosing these cases and when we are going to manage these cases accordingly. First of all, we're going to assess the patients, and after the assessment, after the primary assessment is done, we are going to make out a management plan for these particular individuals. So this is again quite helpful and quite interesting in these phenomena. There are a lot of premorbid and prodromal features that one can look for. So the risk factors, while we're discussing any psychiatric illness, that usually consists of the personality traits of that person, himself or herself, or if he's suffering from any terminal illnesses that is causing any sort of depression in that particular individual, any sort of anxieties or phobias that he may be suffering from. So all of these are going to be quite helpful while we're diagnosing these cases. Now, the history taking obviously is again very important, and that is the mainstay over here. We're going to have the history from the person, and we're going to take the history, a collateral history from the friends and as well as the close relatives. They're going to give you the personality traits of the patient before he was suffering from this condition. The early childhood feeding is again very important over here, and we're going to focus on the childhood of that particular individual that we're dealing with. If he had some digestive problems in his childhood, he or she can develop this fear that if he eats properly, he's going to suffer from the digestive problem again. For example, people suffering from lactose intolerance sometimes go into these pathological psychiatric illness known as anorexia. So the traits of obsessionality and perfectionism are again going to be seen in these individuals. The people would usually be the type A personalities. They would love perfectionism, and that is again going to highlight the fact that they can suffer from anorexia. Why? Why is this important? Because this perfectionism is going to lead into this phenomena that they have to remain thin and they have to look good accordingly. So the low self-esteem is again one of the traits that is seen in these individuals, and the overcautious and anxious individuals. So these individuals are usually over-enthusiastic, overcautious, perfectionists. So all of these traits are basically belonging to the type A personality. So we can conclude that basically the type A personality people are more prone to developing anorexia nervosa. So premorbid obesity is one of the conditions that the person may be suffering from if he had suffered from this obesity at some point in life. The prenatal conflicts and bereavement are again going to be seen in such individuals. The central features would basically include the ICD criteria for anorexia nervosa over here, and that would include the body weight at least 15% below that of the expected body weight. The weight loss is usually self-induced in these individuals. There are no comorbid conditions that are inducing this kind of a weight loss. The body image distortion with a dread of fatness is again going to be seen in these individuals, and there is a widespread endocrine disorder that is going to result in amenorrhea, and that is also going to result in the loss of libido, in anergia. So all of these are going to be seen, all these depressive and the pessimistic thoughts are going to be seen in these individuals. There is a delayed or arrested puberty with prepubertal onset in these individuals. Then the observable behavior is usually the gradual and insidious onset. The reduction of food intake is seen in these individuals. Then there is an overactivity. They are going to over-exercise to lose those extra calories that they had taken. Then veganism is seen. Calories count is usually less than 1,000, and there are secretory and height problems that they're suffering from along with these observable behavior that is usually seen in these particular individuals. Now, anxiety is a very important cofactor that is usually seen in the personality of these individuals while they're suffering from the disease, and while there was that premorbid state before the full-blown anorexia nervosa showed in that particular individual. So the restricting and the binging subtype is again seen in these individuals, and the weight loss is predominantly more of the restrictive form or more of the calorie intake in these individuals. Again, people usually would restrict themselves from eating, and even if they eat, they're going to have that binging phenomena. Binging is basically when you overeat in a single episode of eating. That is known as a binging phenomena, which is seen in these individuals. The episodes of binge eating are quite commonly observed in these individuals as well. There is a self-induced vomiting seen in these individuals, and then there is a use of laxative misuse along with this phenomena of restriction and binge eating. The psychological and social features are also seen. There is a think, talk, and dream, and they dream, basically they want to have more food. That is the thought process that is going on in these individuals. They are usually the slow eaters. They are emotionally unstable and irritable. There is a reduced sex drive, and the social activity is also reduced in these individuals. The sleep patterns are usually disturbed in these individuals, and there is a low mood. There is a depressive phase which is quite commonly seen in these individuals. The cognitive deficit is also seen in these individuals, and there is a fear of fatness that is observed in these people. The psychiatric comorbidities are usually depression, increased risk of suicide, anxiety disorders. So in this section, basically we focused on the symptomatology of anorexia nervosa and how would you diagnose it. So that is the end of this section. Thank you for watching sqadia.com.